I want to understand what actually happens in the background to approve such a drug.
So it's a long drawn process. It starts with your pre-formulation work.
Right.
Then you have your formulation studies. Then you have to create some animal models to test the the molecule. Then you have to do animal toxicity. Once you have your proof of concept properly sorted out with all the stability uh, formulation data, which takes a long time, then you apply to the CDSCO for a CT clinical trial NOC. And then you go through the clinical trial phase, which is again a long process of maybe phase 2 may be needed or directly phase 3. Even after approval, you need to do a phase 4 in most cases. So the entire process from start to finish, would take around say about 4 to 5 years, easily. Some more, some less, and a lot of money spent.
Yeah.
Now this is why many people don't want to get into it, because they were like, let someone in the US do it, right? I mean, why should we break our heads over it? Our job is to sell. And that mindset, I think, has allowed us to basically just copy paste. But for us, our goal is to find problems in India. Like there's not enough treatments of fungal keratitis in India. There's not enough corneal wound healing treatments in India. We are looking at it from that perspective, that can we develop something, and obviously once it's approved, we want to make it a big brand. It has to be a big brand,
right.
But that is a much later thought. It's not about brand building. It's about building the health of your people. And I think that is more important to do in the long term. It's the impact that you create, which I think in the long term will be remembered.
But when you get a drug onto the market, it usually gets approved in India. How did you get global approval for MyAtroXL is what I want to understand.
Yeah, so once you we got the approval in India, we then use that approval to get it approved in other countries, where it's relatively easier without having to do any further clinical trials in those markets.
Okay.
So that process is still happening. We are still registering this medicine in various countries, and our focus has always been on the emerging markets, countries of the global south. It's never been the US or Europe or one of that, because I feel they're quite an overprivileged market. They already have a lot of things. Not that they don't need this,
Right.
but if you go to the African countries, they hardly have molecules. And it's more exciting for us as a company to supply those markets with the best molecules at the best price. I think this is where Indian pharma can have a leadership role. I don't think we could have a leadership role by supplying to the US. We're just there to make money.
Right.
But if suppose you flood the African markets, the Southeast Asian markets with new molecules, new concepts, new therapy. These are emerging economies.
Right.
Then I think you can have a leadership role. So that is why our focus is more towards these countries.
Right.